Hello everyone. This presentation is on Tang, also called Evodia decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Tang belongs to the category warm the interior. A representative pattern is liver and stomach deficiency, cold with vomiting, headache, and acid regurgitation. Important ingredients include Wu, Ren Shen, Shengjiang, Da Zhao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 61-year-old woman with chronic cold pattern nausea and migraine tendency. The current medicines are warfarin, metformin, omeprazole. This case gives a possible reason to consider Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Ren Shen plus warfarin. The mechanism is that ginseng has case reports and studies suggesting it can alter warfarin response. The clinical significance is potentially moderate because INR shifts matter clinically. My management plan is check INR more closely when starting or stopping the formula. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Shengjiang plus warfarin. The mechanism is that ginger may add mild antiplatelet effects. The clinical significance is usually low to moderate. My management plan is ask about bruising or bleeding and avoid concentrated ginger supplements. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Ren Shen plus metformin. The mechanism is that ginseng may add to glucose-lowering therapy. The clinical significance is moderate if intake is poor because of nausea. My management plan is monitor glucose during initiation. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Tang may be reasonable when the patient truly matches the pattern liver and stomach deficiency, cold with vomiting, headache, and acid regurgitation. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.